Welcome. You are watching Focus on Parliament here at Civic Space TV. And this week we shall look back and bring to you the debates that have been happening in the Parliament. And with me, I have an incredible panel that is supposed to help us make sense of what has taken place in the Parliament. On my extreme left is Honorable Martin Zkato, who is a biotechnologist. Martin, you're most welcome.
Thank you so much. It's an honor to be on this show.
Yes. Next is a very familiar face, Mr. Jacob Eyeru, who is the chairperson of Uganda National Youth Council. Is that your right title, Jacob?
Yes, chairperson of the National Youth Council.
There is nothing like honorable, right? Honorable, it is Mr. Chairperson?
No, we're not trying to have a lot of titles.
You're most welcome, sir.
Thank you.
Yes, next is the Honorable Nyamutoro Fiona, who is the National Youth Female MP. You're most welcome.
Thank you.
Fiona.
Thank you for having me on the show.
How is Parliament?
Parliament is doing great.
All right.
We are legislating for the people. It's living up to its promises of being a people-centered parliament.
All right, you tell me more about that as we delve deeper into the show. Last but by no means the list is Dr. David Mujema. You're most welcome, sir.
Thank you. Thank you so much.
Yes.
So, it's a pleasure being here and looking forward to really amazing deliberations. Yeah.
Honorable Nyamutoro, why don't we start with you? You take us briefly what has been taking place in Parliament. What's interesting? What have you been cooking for the nation?
Do I go through what has been going on in Parliament since we joined Parliament, or just this week?
We are interested in the week and
Okay.
really the key highlights.
The key highlights of Parliament this week have been an analysis of the State of Nation address by His Excellency the President. We have also handled the issue of medical interns, the 1,901 who have not yet been deployed. We have had a number of reports by COSASE on national medical stores, on Kampala City Authority, and it has been an intense week. Basically, analysis of these different MDAs and how they are working out, but also how best we can solve the financial crisis that we are having within government.
I looked at your order paper for the week and you spent about 4 hours on a motion to thank the President for the State of the Nation address. Is that an efficient way of spending the taxpayers' money?
Well, it's a matter of procedure. It's actually even more.
Okay.
The debate is still on. The State of Nation address is debated in Parliament for about a week or so. It is very important that the President's speech is analysed, because that is his accountability to the citizens of the country. It's very important that sector by sector, issue by issue, people get to know what government has done, where it's facing challenges, and what it plans to do.
But simply the conversation was less about the discussion on the State of the Nation address, but rather thanking the President.
The reason as to why they say thank the President is because the motion is moved from government side.
Okay.
But in actual sense, it is an analysis of government's achievements, challenges, and where they plan to go.
All right. Jacob, before we delve into the main topic of today's episode, please, you're the chairperson of the youth of Uganda, and many, of course, would like to hear from you before we delve into the national issues. What are the main issues that the young people should be looking out for, or what, as a council, you are paying more attention to?
Thank you, Aris. I think at this time of year, very many things are starting to come out. You know, Parliament has just completed a budget process that culminated into a budget speech. But almost everyone gets to know how much they have gotten about 1 or 2 weeks after, when the appropriation bill is made act. And that is the news that we're now beginning to deal with. One, we found out the budget of the National Youth Council was cut. Two, we found out there was no money. Yes, and all other councils. Two, we found out that the medical interns were not given enough money. They need 80 billion for deployment. It was also not there. Three, we have now found out, I think 1 or 2 days ago, that the students' loan scheme was not funded in the budget. That's also there.
Yeah.
So that's what the National Youth Council is dealing with. That we are lucky that the International Youth Day comes a month or so after the budget reading. So the engagement time leading up to that day is good. And then on that day, we can make sure that those are issues that are presented. And we also have, so to speak, State of the Nation address for youth from the president. But there are also interesting issues that have been coming out from Parliament. Of course, Parliament is always helpful in keeping the accountability of public finances. I've seen this week they've been handling national medical stores, like Honorable Fiona has told us. And some facts were coming out, how money is being spent to move things between Entebbe and Kampala to the tune of about 400 million. Those are the things that citizens will never see if Parliament does not, go into them. Just to also comment on the State of the Nation address, the president makes one State of the Nation address a year.
Yeah.
And so he will make only 5 addresses in a full term. And often, of the 5, only 4 are listened to because the other one is in campaign time. So you want to be sure that what you are dealing with is something that has come through a lot of discussion, something that checks whether the priorities of government is right and whether the direction of budgeting is being implemented, because the budgeting cycle is the contract that government does with the people of Uganda. Parliament appropriates that contract to say it will look like this, and then government must execute it according to the Parliament has given leeway. So when the president comes, it's, so to speak, an accountability of whether the executive has followed the voice of the people and the aspirations of the people, but also what challenges does the executive have that the people should know about, and what are the people being called to in the next year. That interaction must be thorough. And I think that is the logic behind Parliament taking some time. About the motion to thank the president that you asked here, I really don't think that they can fail to thank the president. Because he came and he delivered it.
Yeah. I saw you earlier. I think
Yes.
that was last week in the aftermath of the budgetary reading, and of course you protesting, leading other young people, protesting against issues that you didn't like. Earlier we had seen medical interns also protesting, over lack of money for their deployment. Does this give you an impression that there is lack of prioritization of capacity building of the young people in this country by the government of Uganda?
Is that?
Yes.
Okay.
Yes, a follow-up question.
So because I'm a very active participant in the process of the budget.
Yeah.
We account to Parliament, and then we also make requests to Parliament. From my understanding, prioritization is not dealt with in the figures of government by institution. It's dealt with at program level. If we say government is prioritizing human capital development, human capital development is not executed by the National Youth Council alone. It's not executed by one ministry alone. There are so many facets there. But who gets hurt when we give it less money might not be everyone. It might be a specific section. That's how the National Youth Council budget was cut. So our issue is that there was no necessity to cut the National Youth Council budget in human capital development financing, and not that there's no prioritization of youth. But there are now emerging issues that are also centers of our conversation. I'll give you another example. When you say that medical interns have not been funded, okay, it doesn't mean the health sector has not been funded. As you know, health sector has just gotten salary increments to figures that are not useful for many of the other sectors. They may take offense with those figures. But that shows that government is investing there. But the investment does not solve the issue of medical interns yet. So so you cannot say that there is no prioritization on those issues. You'll just say that there was no allocation to those issues.
But Jacob, and
Yes.
I want you to respond to this directly. If you say that health is prioritized, and at the same time you say there is no money for the interns who are perceived as the backbone, they are the core of the system, then what kind of prioritization is that?
Thank you. First of all, medical interns are people who are learning. Okay? That's the logic. They are not employed by government to execute. They have come to do a mandatory learning experience before they can go into practice.
It's a precondition.
Yes, that's what I'm saying. And after that, very many of them become unemployed. The doctor will tell you. So after that, you need to actually apply and look for a job as a doctor. That is your license to get a practicing certificate. It's like law school. When you're done, you must go to LDC before you can appear before a court as an advocate. But you're finished law school. Even for us as engineers, you have to finish and then practice for 4 years for us before you can be given a license to sign on anything as an engineer. So that professional requirement before you're recognized as a professional practitioner by the body is what is happening. So it does not speak to whether government prioritizes the health sector or not. It just speaks to the fact that government has not dealt with the issue in commensurate measure for medical interns. That most of the medical interns are youth is true. That their number increases every year is also true. So their money is actually not fixed. You can't say when we provide 80 billion, it will always be 80 billion. You can't say even if we say, okay, 100 billion, it will always be 100 what? 100 billion. What we are saying is, and the National Youth Council has dealt with this before, they have been to the youth members of parliament so many times. The issue needs to be structured in a more pragmatic, but also in a more sustainable manner. If you say that we are going to give this fixed figure for this purpose, it's going to take this long, and then we move ahead.
All right, let me come to you, Dr. David.
Yes.
You've been in the thick and thin of this whole medical intern crisis. Can you please help us understand exactly what is at the core of the problem?
First and foremost, interns have not yet been deployed. We had to enroll and do a program of that 1-year mandatory training on 1st April. That has not happened up to now. We're already in July. So that means interns, medical interns, are still home 3 months. And that is, tragic. It's causing levels of depressions you can never imagine. All this began when government, I think when they were planning for the budget, came out. It was the Minister of Health, Allied Minister, Dr. Ruth Acheng, came and said, you see, Parliament, you are arranging a budget that will be read very soon in June. That was before April. But you're not putting money, you're not appropriating money for the incoming cohort of medical interns. We are 1,901, like the Honorable said. And this includes pharmacists who are done with medical school, nurses, midwives, doctors, and dentists. So, when they did not, as Parliament, appropriate money, as interns, we need 54 billion Uganda shillings, and then the senior house officers, call them the residents, need about 25 point something. All these totals up to 80 billion Uganda shillings. This is the money you need to get us to the training centers, which are 58. These are general referrals, regional referrals, and national referrals. Interns do over 60% of the work, and they not only learn, as the chairperson said, but also give government labor. When we're in the Committee of Parliament, we're with the Director of General Services, Dr. Henry Mwebesta, and Parliament put him to task, the Committee of Parliament. It was chaired by Honorable Civic, and they put him to task to explain the background of this money. And he said, look, these guys are not only learning, but they're giving government labor. I was telling you before this show that when you have a relative who finds a problem, accident or traffic accident, anything, relative, friend, anyone, the person you meet at the hospital to begin with is this medical intern. Because specialists are few, and then they put a lot of time in their private facilities, NGO policy research, boardrooms, and all that. So it was very challenging to find out that, for example, in the same committee we had Honorable Minister Msazi, and our money had been put under subventions. And then the explanation of that was, these are funds that can, be got away with in times of a financial constraint and a crisis. But then we're not here only learning. Had we been only learning, maybe we would not ask government to remunerate us, to provide us with accommodation. Again, we are telling Ugandans that as a born of Masaka, I am posted in Kitugum for the first time in my life. I have to wake up at 6 in the morning, and then I have to go to the ward, I have to go to the theater. You're dealing with a ruptured uterus, ectopic pregnancy. This one comes with twins. This one is, you have to go and do Caesar. This one has an intestinal obstruction. You're running for explorative laboratory. All those things. You understand? And then we're asking government that while I am going to attend to these patients who are taxpayers and I'm giving you a service as government, at least find where I can sleep. But if you cannot find where I can sleep, at least give me something that I can use to pay where I sleep. Okay?
Well, David, part of the argument from a section of the decision makers is that just like LDC and Jacob has mentioned it, in the case of lawyers, they pay for the fees of LDC, and the LDC diploma is a prerequisite to practice as a lawyer. And on top of that, a section of the decision makers seem to suggest that even after you graduate, you're going to be unemployed. So why shouldn't this money be saved and put to more priority areas?
In the first place, did you understand why we need this money?
Yeah, that's what I want you to explain to the viewers.
The LDC versus medical internship. I've not been to LDC, but I have colleagues and friends who have been to LDC. And then when you go to court, that day the judge does not come, you go back home and do other things. A medical intern is at that ward, on that ward, every day, 24/7 for 12 months, dealing with human life. Okay? This means you going to theater. This means you can enter that hospital on Friday and leave on Monday. With red eyes, you don't even have any space, not even 1 hour for you to go and use this provisional license that our councils give us to go and practice and have chair, to go and earn some little living. So you invested fully here treating government patients.
But shouldn't this, David, doctor, be the job of the medical officers who are employed by government?
How many medical officers are employed by our government?
Yeah, because that seems to be where there is a kind of disagreement. And I had a section of members of parliament saying that the bulk of work at medical centers is being done by the interns.
Exactly.
But isn't there doctors and other officers who are officially deployed to do this work?
I could give you an example today. If you walk to Kawempe Regional Referral Hospital, sometimes I joke around it like the biggest baby factory in Eastern Central Africa. Go and see mothers are giving, but many babies are there. But find out how many medical officers are there handling each ward. You may find that there are less than 4. In a crisis of a strike, you find like they don't even have a single medical officer there. So most of the work is done by the residents, call them senior house officers, and interns. And all this money that we wanted, it wasn't allocated in the budget. Imagine from 80 billion to only putting 8 billion for interns and 2 billion for senior house officers. So that is a tragedy. And then you're putting these people to a test. How are they going to work 24/7? They're not finding, because we have provisional licenses from our councils that I mentioned above. Okay, I have one from Uganda Medical and Dental Practitioners Council, a provisional license, which will become that final license when I'm done with medical internship. So now that I'm given a right to touch a patient during this apprenticeship program, okay, and you're not facilitating what I eat, where I sleep, how I move, the communication, all the stress, all the night movements, it puts my life at a risk. But then imagine government has invested a lot of money for 5 years school. Some people are from loan scheme, others state house scholarships, others government money. So basically you find people like 70% they are being funded to go through medical school by money which is not theirs. So where is the return on investment? But then you are allowing me sleeping in Katanga because I cannot sustain myself. So where does that lead? My life is in danger. And do you know the cost of losing a whole doctor? Right now when we're dealing with one doctor serving over 20,000 Ugandans annually, a year. You get. So you're losing a very big person in society. That said, if you do not put this money, what are you teaching these young people who are coming through? That extension is allowed. Someone is going to look for what to eat, where to get the money, how to survive. And if they never find that, they're going to deal with a caretaker, and then they're going to tell a parent, or a mother who has come pregnant that, please, if you can give me 300, I can put you on the theater list. So you're breeding extortion, you're breeding quackery. People are going to practice without a skill because instead of learning, they're focusing on getting this survival. So I feel it's not fair comparing LDC program to medical internship. Why? Because here we are dealing with human life. A hungry, wait, in a second, a hungry intern is a dangerous one. Because imagine you're taking a patient to theater, standing 4 hours and operating on them, and then you've not eaten anything. It would be very disastrous.
Dr. David, I agree with you that the significance of the back horse at LDC and the one of medical intern should be distinguished. To that extent, I agree with you. But let me come to you, Martins. You are a healthcare specialist or practitioner, and the government says it doesn't have money to deploy 1,900 interns. You've had, Dr. David explain to us the significance of these interns in the healthcare system. What are your reflections? How do we get out of this whole mess?
Before we get into the solutions, I think we need to have the facts. Because for starters, you realize that these medical doctors have been in school for 5 years. And they start getting towards and doing this serious patient stuff in, I think, their third year.
Third year.
Yep. So there is that fact that they have a thing all too. So that narrative of we are helping them attain this skill through this program, I think we should do away with it. Serious students. And I think by becoming, you see, we grew up knowing that studying medicine is one of the iconic form of education, you know. So we expect that everyone who gets to that course is serious to that level. And by the time they finish those 5 years, they know a thing or two. So when they get there, they do not only attain more skills, but they do a lot. You see, Chairman, you made mention of something, but that's on paper. That we take them. But what is the reality? The reality is everything that happens. Now, I will not even say 60%. Most of the work, if not all, is done by medical interns and then the SHOs, you know. But you realize right now they are not in the hospitals. 3 months. So my pity goes to the citizens of this country.
The patients.
And we have not had a crisis, Martin. Maybe the decision makers have been vindicated.
No, this is a media stunt. You know, there is a way how this country operates. We just have to appreciate the fact that there are times how they twist their concentration on how the things operate. They will give the Oyam election a lot of hype. And they don't go to Kawempe to realize the dead people, the people who are dying. Clearly, because they lacked that attention in one or the other. Now, to me, I think there is a problem of priority. There is another problem of, I think it must be ego, whereby I realize there is a problem between the Ministry of Health and then the Ministry of Finance. I think there is a crash there because this is evident to even a young child.
An illiterate.
You know, that we need specialists, we need labor. In fact, even if we say we need labor, only
but
in
Martin,
hospitals.
What surprises me and what I seem not to understand is that at the Ministry of Health, they are qualified and I assume competent practitioners and public health managers. They're the ones who make the budget, and they clearly knew that the interns are there, but they took a decision to not provide for their remuneration, for their facilitation, meaning that they think that the system can operate without them.
Demand, you see, when they're defining demand, they say the ability and willingness. You might have the will. As a planner, you have the will, you can say we need this, but you don't have the ability to execute what you will. That is what is happening entirely. And we should, by the way, we should be real to ourselves. That is what is really happening. You see, the politics has overshadowed some of the things that we really need to get hands on. Seriously, may I feel so bad about the citizens, and I will make this clear. This government has betrayed us as the citizens,
Okay.
and we feel
All right.
some attention should be
I don't know
put
whether
on
Jacob
life.
and Honorable Nyamutoro agree with you, but let me come to you, Honorable Fiona. You've heard from colleagues on the panel their thoughts about internship, but I also would like to ask you, in the same week we've read about the scrapping of the students' loan. Are we in a crisis?
Well, we wouldn't say that we are in a crisis. The truth is government has been struggling with budget cuts across board. The Ministry of Finance states that the reason for this is because they shifted to program-based budgeting, like a year earlier hinted, and this calls for repurposing of the budget. This is a word that I learned from the PSST of finance.
Yeah.
Because at that point, I was questioning myself whether I really know what repurposing means or I don't.
Yeah.
You see, one thing that the population does not entirely understand is that Parliament, over several occasions, has appropriated money and it is not implemented in the sense that it was appropriated. And citizens do not seem to understand why Parliament would appropriate money and the implementation is less than what we appropriated. But that is actually what is happening. These are different arms of government. We do our part, and then the executive comes and says, we have to repurpose this according to human capital development. Ourselves as Parliament, we ask questions. And that is when repurposing got a totally different definition from what ideally we would call the dictionary meaning. Now, in such incidences, what it means is that we have to go back to the basics, right from the process, the initiation of budgeting. Can all ministries, departments, and agencies be prepared for program-based budgeting so that we don't have this discrepancy? One of the reasons that's why we are having these challenges with the medical interns is, one, it's far-stretched. It doesn't just start today. You cannot claim that you are overwhelmed because the numbers are growing. They have to grow because Uganda is also not the same. If we were 20 million some years back, today we are 40 million. You'll definitely have more people go for medicine or any other profession. But over all these years, there has never been a policy that guides medical interns or internship in general in all sectors. They have been working on guidelines and a common law that every year an intern, a medical student graduates, they have to do internship as a prerequisite of getting a medical license. Now I think we have come to the center and the genesis of the problem. Now that we are facing it at this time where we have a high number that has not been deployed for some time. So we are asking the Ministry of Health, can you come up with an appropriate policy? A fully fledged criteria that is going to solve this problem once and for all. Because to be honest, it might not be possible for government to always pay all interns with the increasing numbers. But if we come up with a policy, we would know how to streamline them in their different categories. There are private students who can handle their internship fees, who can cater for themselves. To what extent does government come in? What is government's contribution? What is the student's contribution? I think if Ministry of Health does that as Parliament passed recently, we would have a problem solved. There are also very many questions that are rising out of this discussion. You saw one of the recommendations of the committee report was that, can we subject these students to another exam?
Which is wrong.
As a way of quality control.
Parliament refused.
And also regulating the numbers, maybe.
That's wrong.
Not regulating the numbers
That's
per
malicious.
se. Of course, I think it regulates the numbers indirectly, because I remember at a time when LDC had pre-entry exams, the numbers were few until it became a problem and they had to do away with it.
So what was their aim of that pre-entry
The claim was quality control.
Oh.
Quality control. But you see, if you cannot have quality control in the 5 years that someone is
I know,
studying
right?
medicine, then you can't ascertain that an
Quality in 3
exam,
hours.
an exam is going to establish
Exactly.
it. What if the person is having a bad day?
I thought
All that said and done.
the exam was to serve the purpose of actually limiting the numbers.
That is
They said the quality
No, the
very
justification
true.
was quality control.
Yeah.
All right.
Anyway, all that
Yes.
said and done,
Yeah.
we really need to get back to repurposing our priorities as a government, both at parliament level and also at executive level. We understand very well fully that the population is growing and we cannot stop that. The number of available resources is very inadequate. So government's capacity to deliver adequately to the expectations of the citizen will always be underweighed. Now, how we deal with the few available resources to satisfaction of our priorities is what matters most right now. And I think that's where all our focus should lie.
Yeah.
Yes, Jacob, I see you'd like to come in.
Thank you. And I really want to thank Honorable here for bringing it up. You know, we need to be an honest nation. Are you transiting with the change that is coming, or you are insisting on a position that no longer works in the face of new facts? There was a time when university education in this country was free, and to arrive at university, you were paid.
And the job was ready.
And no, a job could be ready or
At
not.
some point, you would
Yes,
be given
but
a
there were
bachelor.
enough jobs.
Yes.
Yeah.
It was automatic.
You would be paid, and you would sleep, and you would even be transported to the university. The country grew, made more money, but that policy could no longer be sustainable because there were way more people than the finances would sustain. That's when government said, okay, let us have a merit-based system for choosing who gets this. After government got that, they said, okay, even this has become unsustainable. Let us have a merit-based system, give tuition, and then a few more things, not everything like before. Now, we reached a point of saying, actually, we can't even sustain that now because there are too many schools now with too many people passing. Let us raise cutoff points. And they rise to a point which is insane in some cases. So you begin to see that there needs to be a change that handles something that is coming up. Medical interns are very important to the health sector. They are necessary. But that's number one, a problem of management of the health sector. Why aren't there doctors when they are paid doctors? That's a management issue.
Exactly. And that's what
that's one of the things. You asked a very damning question. Where is the crisis now that they are not there for 3 months? You see, government is a very funny place. If you're offering an argument that is not sustainable in time, government can say, let us watch what happens to the health sector now that medical interns are not there. If 5 months down the road they are still not there,
And
but
it works.
but the medical sector has no crisis, they'll say, why have we been paying these people? So my advice to the medical interns, because I understand it's not them that create policy, it is them that suffer the policy. If we are saying that we cannot deploy them, then what Honorable Nyamutoro is saying must be fast-tracked. How do we get a policy so that everyone goes into third year, fourth year, knowing what's going to happen?
Because not just the medical interns, but across the entire education spectrum.
All the courses in Makerere, no one would know that I am going to an internship to be paid. I will be providing actual labor. I did internship, she did internship. When you're there, you are not doing periphery work. Sometimes you're doing most of the core work, depending on your competence, okay? And even as you're learning, you're providing labor. But to have payment is an added advantage, and it is an in-house policy of that company or something. If government says medical facilities are very important, we must always have this labor, government must come to a position of saying, how many can we take under these conditions? How many can we take under the next? That policy needs to be fully known. Otherwise, we can't keep this ping-pong game every year.
Let me answer, Chairman.
Yes.
You see, like Honorable Nyamutoro said, that we are dealing with a policy problem.
Yes.
Right now, having such a discussion with people who have spent a year home, you are firefighting. you are crisis managing. You are not thinking about these people who are stuck today. We don't have a problem with policy. Let the policy come, but please get these people at least deployed. We are wondering, we've engaged the PS of the Ministry of Health, and she says, you see, education is not, through the National Council for Education, is not regulating the numbers. You understand? So, you see, we are suffering a miscommunication, a mismanagement problem, which we think this should not really entirely be on us who have sat home for 12 months and then we are sitting more and more. We think, government has handled some crises before. Let these people go to the hospitals. Let me tell you what the Ministry of Finance has asked.
No,
right?
before you take us there, Dr. David, there is something that Jacob said. I'm coming back to that. There's something that Jacob said, and he says that there should be some standardization of internship across all the disciplines. And David, doctor, argues that you see, the medical profession is a special one. That whereas they are all interns in a sense, but these ones can be distinguished, and they should be distinguished. Why would you argue otherwise, Jacob?
Okay. In 2021, we had just come into office. We spent about 2-3 months on this medical intern issue. We had several meetings with them, fighting for that same problem. There is no money for them. When I see it play out exactly the same way, I know that the solution we applied does not work. So for me, the solution which works is to say, can you have something longer lasting?
Yeah.
How do you standardize work so that everyone knows what they are going to do and does it in appropriate time? If you don't have that, my brother here, I think he has been elected president of medical interns. Is that
We haven't yet.
you haven't yet?
Yeah, but
the president of medical interns is elected on an annual basis. Okay.
But how do they elect that? That's another question that I want to come
Interns,
as long as you are posted in the sites,
Yes.
then we elect leadership among us. But this crisis didn't allow us.
The reason as to why I asked that question
Yeah.
was because there was a very interesting fact that arose during this debate that Ministry of Health actually does not have a database
Of the all interns.
But that's
the
wrong.
entire
No,
intern.
all councils submit the
Yes,
names,
yes.
and our names
They
are already
have.
distributed
They
across
do
the
not.
50.
Okay.
No,
They
the
are-
Let's
names.
come back to your argument, Jacob. Yeah.
But that's a good point, Shane.
Yeah.
I would want to
I'll debunk that.
I think,
Yeah.
About
So-
the management of the information.
yeah.
Because
So-
yes.
So no one here is saying medical interns should not be deployed. What the medical practitioners here are saying is that we must be deployed now because there's a crisis. We agree. But from us, from a policy participating position, I, as chairperson of National Youth Council, she as chair of the Parliamentary Forum on Youth Affairs, we can't keep dealing with the same issue every year. We are not learning. We must find a sustainable solution. Even if it applies when we have left, would have contributed to a better Uganda.
But
This
something
is
small.
how
There is
bad
something
the
small I
issue
want
is.
to add on to what the chairman said. You realize that last year, interns used to, the other year, that is 2021, interns used to get 750. Then 2022, the good president stood and said, we have to prioritize the medical sector.
No, actually,
How come?
statistically,
Wait.
2018, I just want us to get the facts right. I think 2018, the allowance was 750, and it was increased to 1 million in 2019. And 2021, the president actually made a proposition, actually presidential
Directive.
Yes.
that they should receive half of what the medical
professionals
officers, are receiving. Yes, make your point.
Now the real problem, I think, starts from the fountain of honor. You see, you cannot make a directive without a plan. There is no money in the country. But you clearly come out and say, I have directed this. In fact, I think that is the main reason we are in this crisis.
But you people were saying that the money was not enough. What solution did
Yes,
you
no,
have?
okay. But do you have to just direct without planning?
No, you
Okay.
see, how budgeting
You are the
happens,
fountain of honor.
Yes.
There
How
is a
budgeting
crisis.
happens, Honorable Nyamutoro will tell you. Government does not budget because they have the money.
They don't.
No, they budget in anticipation of how much they will get. Then in the middle, ups and downs, you realize that we can't meet it. But if you're already committed to it, betting on the logic, you don't go back and say, no, we are not going to give you those salaries, we are going back. If the logic was right, in which case I think the directive came in the logic that medical interns do a good job, they should be paid half. But the money is not there. That should not be a precondition for the medical interns not doing internship. For me, that is my position.
All right, members, we shall
And the
take
situation has even gotten worse.
Yeah.
I just wanted to substantiate what Eyeru was explaining earlier.
Mm.
You see, as we were talking about the 1,900 who have not been deployed now, what is more interesting is that the budget that just passed, Ministry of Finance allocated to cut the budget of interns from 52 billion to 10 billion.
54 to 10 to 8.
Ladies and gentlemen, we shall take a very short break. And when we return, we shall conclude this conversation on the issue of internship. And we shall also delve into what has become really another crisis, the DNA test within the public domain. To our viewers, thank you for staying with us. Please don't go away. We shall be back shortly.
Digital rights are those human rights and legal rights that allow individuals to access, use, create, and publish digital media or to access and use computers, other electronic devices, and telecommunication networks. Digital rights include a right to freedom of expression, information and communication through technology, a right to privacy and data protection, a right to credit for personal works, a right to universal and equal digital access, a right to identity, a right to anonymity, a right to be forgotten, and a right for protection of minors, among others. The state's digital rights are frequently violated through various unfair actions, for example, blockage of websites and social networks, theft of credentials, unauthorized use of people's data for personal gain, privacy intrusion, online censorship, arrests and intimidation of online users, internet blockages, and the proliferation of laws and regulations that undermine the potential of technology to drive social, economic, and political development worldwide. It is hence every citizen's responsibility to respect rights of other digital users and to speak out or report to the responsible parties when one's rights are violated.
Welcome back from the commercial break. Please do follow us on YouTube and Twitter at Civic Space TV. Gentlemen, before we took a break, we are still looking at the issues to do with the internship of medical students, or the doctors to be. So the Honorable Nyamutoro, David, before she left, she made a proposal about cost sharing, where government pays part of the cost and you also meet part of the cost. How does that sit with you?
Well, it doesn't sit well because I think there are so many things that this government is prioritizing and they are not so much important. It is hard to explain that a few, just a small group of interns who are actually giving government a service cannot be a priority. And if you're looking anywhere to cut, you're cutting the interns. But again, when she spoke about the policy, I so much agree. I'm one of those people that say that we need this policy as soon as yesterday. You see, mine now, I'm so much invested, whereas in the crisis at hand and being a victim of the situation, but also we have to look at the future, but then bring all these stakeholders on board while we are investing, while we are investing in this future. Cost sharing, I mean, like, why? Regulate entry into medical school. Wouldn't that be better? If you're putting exams like Parliament, by the way, refused that exam at the level of internship, put it maybe, crossing from biomedicals, going to clinicals, and then when you're finishing clinicals, we can even say, okay, we accept, let internship be embedded within the 5 years of what? Of med school. So that leave the interns that come to do the work and come to do their training before they get the license, get this remuneration. I am telling you, if you subject the lives of...
Why is cost sharing?
You see, you are on an assumption that having gone to medical school, actually parents can still look after you. There's that assumption, okay? But now you're having people who are on state of scholarship, who looks after them? People who are on loan scheme, who looks after them? People who have, had all these other support systems. There are Muslims, the Catholic communities, the donors, the what. People saying that as long as we get you through medical school, you are entirely on your own. And I'm telling you that is the biggest percentage of people who have gone to medical school because they've studied very many years. It is rare that actually this money is out of pockets of parents. So you throw them to the intern sites, far places, doing all this work, and then you want to step away, walk away from the responsibility of helping them out, remunerating them, accommodating them. Let me tell you, internship in the law is a responsibility of government.
But David, don't you think it's also fair for you to consider the sustainability question? Government argues that the numbers have been growing bigger and bigger, and it's no longer sustainable to, support you the way they have been supporting you. Don't you find this a fair argument?
I can say, being honest, it is. It would be fair if government was meeting its end of the bargain, okay? Other than waking up and say, we cannot look after you, and here we stop. We are stuck. We are not going anywhere. If government was minding who enters medical school, if government wanted to regulate the quantity, and it did whatever these exams it's trying to put across at different levels, then it would have taken measures on its side, on its end, we wouldn't be in this position. The problem is government saying it's okay. National Council for Education is not doing its job. Ministry of Education is accrediting all these universities and giving them different charters. We have about 50, everyone is starting a medical school. And then at the end of the day, you come to the Ministry of Health, councils send your names to the ministry for distribution and posting for internship program. And then government says, we have nothing to do with you. We do not have the money. The same government that has the responsibility. So I'm saying, instead of concentrating on punishing these people who are waiting for their license to go and practice and have a living out there in life, I mean, like, why does it government do its work at these preliminary stages? We wouldn't have this discussion.
All right, Jacob, I want to conclude this segment of the discussion with your thoughts on cost sharing, so the internship program.
I don't support cost sharing. I support a sustainability plan. Because even in cost sharing, we're in the same issue. Where in the long run, when this country is producing 10,000 doctors a year, cost sharing will come back to this budget issue. I support a sustainability plan. If government is going to sponsor as a matter of policy, it should sponsor for an amount of time until a limit of reach. If government says we're not sponsoring, government should say early. So that in turn stops stressing with hope in that. Because now you are having people who cannot practice. Do you understand? They will not be able to have professional practicing licenses because it's a precondition. But the policy has been, or the practice has been, that government pays. Now the practice is changing in a circumstance of uncertainty for them, because they came into a practice, awaited for execution of the practice. You are now in the football field, and then the referee says, you know what, now this is how you play. You play 4-4 people, and the other side they play 10-10. It doesn't make sense.
Yeah.
If the game has already started, it must follow the practice that has been there.
You don't change the
rules. If you intend to change the rules as government, change them for the next lot and change them in time, not to be in the same crisis. For me, that's my issue.
All right. All right, moving on to the next segment. Let me come to you, Mr. Kato Martins. There is a raging public debate about DNA tests. Many now argue that it has become a threat, and the Honorable Member of Parliament has even proposed that it should be listed among the restricted tests in the country. I want us to start from the start. Please take us through what is a DNA test.
You see, this is an impasse that is going to take us for quite a long time, because anything that attacks family is, even in economics, it is the household income that sustains that GDP. You are the people who do those things. So this is an attack onto the building blocks of the country. DNA is simply a blueprint of anyone, and a parent has to pass it on, because they are just two strands. So a parent has to pass on one strand, and then the child also gets one other strand. So the logic here or the problem that we have realized, I think, depends on the result. Now, this is how things should be done, I believe, based on this crisis that is happening. One, we should be clear on who performs these tests. That is one. Two, how are these...
Before we go there, I just want, for some of our viewers that may not understand what the DNA test does, I would like you to clarify that and tell us the importance of its role, and then we can go into regulatory and other structural issues.
The DNA test is specifically for paternity. When I talk about paternity, I literally mean to realize that Jacob is my father, or I am the son to Jacob, not Harris. That is entirely what the DNA test is all about. However, it is a long process.
Does that include mothers?
No. The mothers, you see, we have, I don't want to go deep into the science, because for the mothers, we follow, it is, you see, the DNA is described into, there is the nuclear DNA and then the mitochondrial DNA. The mothers have the mitochondrial DNA, but the fathers don't have the mitochondrial DNA. So
a mother can't go for a DNA test?
No, that is not a DNA test, but
so what?
It is it is mitochondrial DNA. But why is it not described as a DNA test? Because what they base on always is the other nuclear DNA. But they are chromosomes, because on production, the father produces 23 chromosomes, and then the mother also produces 23 chromosomes, and part of that. So there are those clear strands, elements on the strand that can be clearly identified that, okay, this is the mother. So that is the logic behind that. But oftentimes it is always clear that, okay, you are the mother of the baby.
There have been stories where, we've had stories where in hospitals, the mother gives birth to a child, and the story that the child...
Yes, that's why... Yes.
So you want to confirm
no. I didn't say you cannot take DNA from the mother. I just separated on how the two works, the mitochondria and the nuclear DNA. Yeah. But like I said, the process is long. In other words, we start the process from picking the sample. Or as they use cheek swabs.
Without going into the
No, I'm just telling you how problems come. By the way, the problem is about how results are interpreted. That is the problem we have. Generally, that's what I believe. You see, you can take a sample and you mishandle the sample. Two, extracting DNA, the problem also comes in there. Three, during the process, the PCR, the sequencing, and then the interpretation. You can use reagents, and reagents don't go the right way. So all that, because these are computers, these are what? Now, the fact is, now, how do we handle the results? To me, this is what I advise. One, when you get the results, there are two results. It is either positive or negative. So when you realize that it is positive, that one is okay. Now, if it is negative, this is what we should do. I think we should do the tests thrice to be sure. Now, on realizing that after the 3 times, it is what? Negative. Now, this is where we go ahead to seek for a counselor, to sit down with the parents, because it's not a fault of the child. Child has been here for maybe 10 years, 15 years, and he has realized that Jacob is not my father. So I think it's now calls for sitting down and realizing, talking, and then you deal with the mother, but you take on the what? The child. But the biggest thing I believe, what should be done, you see at birth, the good doctor will tell us, there are some tests that are done all vaccination, the BCG, the vitamin K, So I believe we should have a plan. Because if this one has become a national issue, if we can come here and discuss this, that means it has become a national issue. I think what we should do clearly, we should get specific hospitals with specific workers. Someone who should interpret should be someone who did bioinformatics, not a mere nurse, you know.
All right.
Someone who did molecular biology, not just, you know.
Yeah.
These are areas of specificity. So tests should be done in the hospital on birth. You say, okay, Kawempe. How can Kawempe, regional referral hospital that is specialized for reproduction, lack machines for DNA? So I believe we need to have that, such that from reproduction, from immediate onset, we know that, okay, I'm not the son to Jacob, and then we
are going to come
plan.
to that, Martin. Let me come to Dr. David. You know, part of the debate is that there are allegations, there are claims that the fathers or the alleged fathers are using the DNA test to, you know, victimize the women they no longer like. So we are told of fake DNA tests where you go to a center and they give you results which show negative when actually it is positive.
Yes.
Yeah, how best, can you tell us about our capacity of DNA testing as a country, but also how well this important service can be regulated to avoid such issues that are cropping up?
Thank you. You know, this is an interesting conversation.
Yeah.
Our country is really amazing. You wake up, you know, you get.
Yeah.
So, but now,
That is DNA in Uganda.
they say Dalanzamuzara. So, but
Okay.
I think, whereas it's true,
Yeah.
you know, we're dealing with human beings.
Yeah.
There's that, you know, there's that loophole that people who are having their personal issues can always abuse the process. I don't think going for DNA is a bad idea, but it is being abused. You know, we're dealing with a society where people abuse everything. Okay? Someone chooses to be malicious, someone chooses to blackmail, reasons wealth, inheritance, and all that. So if the person who claims that this is your child and you're denying that this is not my child, and both of you choose to go to a center which is not credible enough, not a government recognized laboratory, then that is not the responsibility of the government, of the country. Like, you've chosen something which is substandard, you've chosen something which you clearly know it's going to lead to chaos. Even when we have government laboratories, like the one headed by Dr. Bwanga in Nakasero, okay, you find that rich people even go a notch higher and don't believe even in the results at the national laboratory. They send some samples to South Africa, others to UK. That is the extent at which we are. Even what you believe in to be the most credible, you understand, people can claim that samples were mismanaged, like Comrade Kato has said. You get? Because there's that margin of error. You get, you're dealing with chemicals, you're dealing with reagents, you're dealing with things that have computers that have a time frame to fail and all that. You understand? So I don't think, as a country, by the way, what I think right now is that, well, Parliament should now come through with a policy, because everything goes back to legislation. And then the country is told what real labs can handle this DNA with the credibility that this country deserves, other than people moving around, going everywhere in Bufunda, doing DNA, which is causing chaos. Comrade told you that family is the, is the basic unit of a country. If you start messing around this country, when people are all over the place jumping, these are not my children, this one is not my child, you're going to cause chaos. We've all been following in the news when the internal affairs people are saying, people are coming here saying, please unwrite this child from this passport, does not belong to me. When these children actually were flying to go abroad for further studies. And then the men, the owners of families, are realizing these are not my children. Imagine how painful it is. You have a girlfriend, you sire a child together, and then you've been taking this child, all your savings, to an international school. You get, I won't mention names, you know some of the big schools out there. You get, and then after 10 years, they are telling you this child is not yours. I am telling you psychologically, you are not going to remain the same. So this comes back to a question that now that the debate is here.
Is the problem the test, or the problem lies somewhere else? Because this is a fact.
It's
you're either ignorant of it.
Let me tell you, it's multifactorial. You get, as family, now that we've had a debate, I don't know if this was the right time for such a kind of a debate, but here we have this debate. So now it's hit Parliament already. And then now Parliament comes in. When does someone do DNA? Where does a person do DNA from? Why would someone do a DNA? You understand?
Okay. Let me bring in Jacob. Jacob, DNA has been around for some time.
Yes.
I mean, by 2000, the technology was already here in the country. What has, propelled this kind of conversation? The demand all of a sudden is going through the roof. Why now?
DNA has become like telephones.
Yeah.
When they were first invented, they were for a rich few.
Yeah.
I can vividly recall in 1998, when I was in the lowest level of primary school, I could see what it meant to have a phone, which you would press. It would only light yellow, sometimes greenish yellow.
Service fee.
And all it would, and all the phone could not fit in any pocket.
Yeah.
It had to be held specially and so on. Just a few years later, maybe 10 years later, everyone had a phone and the sizes had fallen. 20 years later, no one had those phones. Everyone had a smartphone. In that time, government could ban something which is accessible online. But today, government can't ban anything and it is banned for real. There is always a way to access anything that you want. Either virtual networks or you're talking about proxy accesses. Because the world has moved and those things are more accessible. That's the same thing with DNA. In the beginning, the only proof to who is your father and mother was their saying, I am the one you call mom. If a child is born and given to a stranger and that stranger says, I'm your mother, the child will know that's my mother. Until a day when they are met with someone else saying, actually, this is your mother. The child will have no way of proving and they will not become more attached to this new mother. They'll be attached to the other mother. Children grow up through a procedure. And for me, that's the logic. Where is a child's place in this commotion? If we want to move forward as a nation, DNA testing must be restricted to people below 1 year of age, such that they grow up with the cognitive knowledge of who is taking care of me, not to shatter the life of a possible Ugandan leader, a possible Ugandan scientist, a possible Ugandan teacher at some stage of their journey by telling them your entire parenting, your relative structure is wrong.
Was a lie.
That is the basis upon which existence is. Everyone is working for their children, they are trying to protect their relatives, and they are trying to fit in a society of common people to them by some way of relation. If you attack that and you as a country don't control that attack quickly, you risk losing even the best of your country to some jokes. Why? Tomorrow, I know that he's a rich man and I want to to create a problem there, maybe for my own business benefit. I tell someone to propose to him a DNA test on his children just so that he knows whether these are his children. He does it, I pay a lot of money to make sure that the result is wrong. And then he goes into some sort of just chaos in his mind. He will never be the same again. I use that. In politics, that is going to be a ticket for people to say, do you know that this man is not a son of this place?
It means that,
Said, are you sure? Say, yeah, this man, like, I come from Soroti. They are Kumams and Iteso. If someone went there and told them that this year is not a Kumam, this year here is actually a Mugisu, they can't vote me.
That would be the end of your politics.
It is the end of your politics there.
In that area.
Do you understand? So those are areas that need to be dealt with. So that In the event that the country wants this to continue, we move into family court sessions. Family law exists. It becomes a prerequisite for children above 1 year of age to be tested for DNA, must be through a court order.
Yeah.
So
there are those who say that it should be done at birth, and I would support that.
I
immediate
don't
at
support.
birth-
I don't
why
support
don't you
birth.
support at birth?
At birth, there is a delicate life. Number one.
Delicate
Number
in
two,
which sense?
delicate for
Of
both
the
mother
mother.
and child. The child is still under internal medical attention and care.
A neonate.
Those are neonates, you know. They are so susceptible to so many things. You don't want people who are the parents, so to speak, even if one of them is wrong, to be in a situation where one is causing the other psychological problems. The mother can decide to abandon child. The father can decide to kill child because they are disappointed at that moment. You don't want a medical worker who is dealing with, maybe the mother has come from a C-section, who is dealing with maintenance and watch on the mother, to also be dealing with psychological issues on the mother. You don't want that situation.
Jacob,
So
make
give
some
a grace
sense.
period of a year.
Yeah.
The child is not yet in a position to know who mom and dad is for long enough. You can do that.
Yeah, Jacob, what you say is fundamental in a sense that it carries certain undertones of deeply seated societal issues. And key among them is the imbalance between the gender. When a man has children outside the official marriage, it's not a problem. When the woman has a child that is outside the official marriage, is a problem. And this now, of course, the fact of this...
No, it is also a problem when the men do.
No,
It's
be-
just
because...
that men are more scary
yeah.
in our
Patriarchal
society.
society.
Why
You
should
know.
it be? Why should they be more scary? Should it be equal?
I agree, we should be equal,
Yeah.
but the reality you have is that we are not.
Yeah.
Yes, that is
So
the
in
reality.
that situation,
No,
you protect the marginalized.
No, why?
Who are the women?
What do you
But
mean
me,
we
I
are
would
not
differ.
equal?
We are not equal. Maybe just to make this point. Right now, I'm a married man.
Yeah.
If tomorrow I said I have a child, my wife will have a lot of thought before she can say we have to have a divorce.
Society will push her,
Yes.
but society cannot push you to keep with her when she tells you she has a child outside your marriage.
Yeah,
Why? Why?
No, that is society.
Now,
setting.
you see,
Some things
society
cannot change.
society is an intricate process of building, construction over years. Yesterday, I was involved in the Oyam by-election campaigning for the NRM candidate.
Yeah.
And one of the comments that my boys and I were making is that we didn't know women in Oyam can be allowed to wear trousers. Because for me, growing up with my elder sister in Kampala, my mother would not let her wear trousers. So that societal change takes time.
Martin, I see you agree with Jacob when he asserts that society is the way it is. It is unequal. And you don't seem uncomfortable by saying it is unequal and it is what it is. We get used to it.
You see, my biggest concern, I agree with that society is like he explained, and that is the fact of the matter. You see, we should be real to ourselves than thinking things out of the paper. You realize you create a perception and you think things should work like this, but what is the reality? But the other thing that is also crucial, I think in this way we credit men. Why? You realize when a man gets a child outside marriage, in a world too, finds a way of coming and informs the woman, all can find children and tells them, by the way, you have your sister, there is a sister out there. I'm soon bringing that sister to you for introduction. And the mother will pick that message.
And the wife will accept the child.
Absolutely. Now, the case with mothers, the mothers, while you are doing DNA right now, the mothers never talk.
Because of the societal pressure we talked about.
So they keep quiet until when we do the DNA, that's when we realize what is happening. Now, it is, you see, the society is about a narrative being set. If we can have the chance to get bold women, we won't be blaming nature. When a woman does that,
let me frame the question this way. Assuming you're married and you've brought, life happens along the marriage. You bring a kid to your wife outside the marriage. the wife accepts the kid, takes care of the child, and then along the way, life happens. She tells you she's the newborn is from another man. Would you accept?
I would not accept.
But
then, the other thing, we also,
Jacob, I want to ask you this question. Hold it up,
okay,
hold it up. I'm coming back
yes,
to you. I want
yes.
to ask you this question. I've asked
Jacob.
you to these two colleagues. Would you accept Jacob?
I think let's hear from him. He looks more humble and ready for the question.
And unfortunately, I don't have any lady on the panel.
No.
It's a shame.
I am going
We had
to respond.
For our
But I want to
viewers,
give,
we had Honorable Nyamutoro, but unfortunately, she's a female member of parliament, but she had to leave. So please excuse me. Yes, but Jacob,
What is
your
the
answer?
answer?
I was saying that my younger brother here should give a more woke
Dr. David, would you accept the child?
You see, the question is tricky.
Well,
Why?
it's straightforward.
You see,
It's
yes or
straightforward.
no.
You see,
Yeah.
the background is,
Yeah.
in the first place, it goes back, why did this woman have to lie? You know, why did she
No,
have
no,
to
no,
lie?
she has
No, no.
not lied. The question is, you are in a marriage,
Yes.
and along the way, life happens. You contract or you see a child outside the marriage. You bring the child to your official wife, and
She
she
takes care,
accepts
yeah.
take care of the child. Along the way, life happens for her. She sees a child. She gets a child outside the marriage, and she's like, you know what, honey, the newborn is actually not your son. Would you accept the child?
Oh God!
But you recommended him as the most
you've,
trusted person.
both of you have gone at that. So you've done this already.
So colleagues, I think you
I
see
have
that
not answered the question.
Yeah, please answer.
For me, it's one of the most important sessions before marriage is marriage counseling,
Yeah.
where you make choices and ask yourself questions that you don't expect to be thinking about.
Yeah.
Like, what will happen if you cheat?
Yeah.
What will happen if you find out you have a child outside?
Yeah.
Those conversations are uncomfortable,
Yeah.
but they are necessary before you marry someone,
Yeah.
because they help you to know what's going to happen.
Yeah.
I can tell you for sure, if you have made the error of being the father of a child that's not outside wedlock,
Or the mother.
you must be accepting
Yeah.
Yes.
of the same error
Exactly.
and extend the same olive branch
Exactly.
and how to
So fair enough. Kato,
But
as we
then,
conclude,
yes,
our time is fast
but
spent.
then our mothers, all the ladies, you realize that even the DNA results shock them. Are you aware?
Yeah. They also get
You
shocked.
see, when they are making their rounds,
In 1 minute,
yes,
please, we have
when
to
they are
conclude
making
this,
their
yes.
rounds,
Yeah.
you know, they don't acknowledge.
Which rounds? do
No,
you
no,
mean?
as in when things are, you brought it in a
Yeah,
better way. When
yeah.
things happen with
Okay.
other people,
Okay.
so they don't really be sure whether during the other time when I was making rounds with the other one, it's when
I got
No,
pregnant.
you can
I
say
got
when I
pregnant.
had
Because
sex
when I
with-
come to my
when I was
my
adult
husband,
person,
we
when I
have
was
our
having
thing
sex.
always.
Why
So
don't you call it sex directed sex? Isn't it?
Okay,
Sex?
yes,
In
Or
other
you
words,
are
you find that a
adulterous.
lady slept with the real husband,
Yes.
and then she thought this cheating
could not
it
matter.
could not actually result in a pregnancy.
yes.
So for her, she
was-
even
she was
years
having
pass,
fun.
she forgets
Yeah,
about it. She even thinks that was a fling, you just
Yes,
met and something
yeah.
happened, and then to the extent that no, actually this child was the other man's child,
Yeah.
not
No,
the
but not
husband.
even this
Which
thing of
even,
flame.
listen, is-
People agree,
Yeah.
Harris, and many young men know outside there that women have so many methods they think men employ.
Yeah.
Please don't release in me. So there's this thing I hear around youth, withdraw method. That just before you
It's
get
an
out.
effective method, actually.
So you see
Not
the
really.
experience.
Our
You see,
This is the
moderator
experience I talk
is
about.
good.
So if you're saying it's
I'm not speaking
effective,
from experience,
then how have you found out?
from science.
Written in research.
So the woman goes around with withdrawing
Yes.
when the men who are withdrawing also think they have withdrawn, only to find out that Junior here was
So,
in
was a
pre-cum.
consequence.
Yes.
So you realize how ladies
Alright.
don't tend to know what really happens, and men, for them, it is sure they do. So that's why I credit men in
Thank
society.
you very much, gentlemen, for the exciting conversation. I would like now to give each one of you 30 seconds to give to our viewers your last message.
Thank you so much. Like we said, we've engaged all government ministries and then the Ministry of Finance. They're promising that at least the cabinet on Monday next week, they're going to state a final position about medical interns, and we are asking government to handle the crisis at hand, have the interns deployed and deployed with pay, and then we now focus immediately when you get to the sites, 58 sites, we focus on policy so that we can save the same government of the future stress. I thank you. My name is David. See you next time.
Yes, Jacob.
I think that our country needs to now call on action by young people in unity of voice, because many of the issues that have been emerging have been targeting groups of young people. It is young people who benefit from the loan scheme. These medical interns are 98% young people. The National Youth Council is clearly for young people. So we might need to have a conversation around the generation and how government is treating the generation, as opposed to just spontaneous looking at matters.
Thank you, Jacob.
Maybe to differ, I think they have said it all. Me, I will be calling upon a people of Buganda Kingdom to usually attend the Masaza Cup that often happen over weekends. The King of Buganda opened them on the 24th of June. So I call upon all the Buganda to come up and we support our Masaza Cup. Thank you so much. Martin Skato is my name.
Thank you so very much, gentlemen, for that insightful conversation. To our viewers, it is always a pleasure to have you. Thank you for always tuning in. Please don't forget to follow us on YouTube, Twitter at Civic Space TV. Been watching Focus on Parliament, and been your host, Harris Ocampo. Goodbye.